Mr. President, Mrs. Clinton, with President Clinton's signature on this bill, the long gridlock over health reform is finally broken. Help is on the way to 25 million Americans who have borne the burden for too long of the worst abuses in the current health insurance system. Families deserve the security and peace of mind of knowing two important things: that their insurance will not be canceled when they are sick and need it most, and that they will not lose their coverage or face new exclusions for pre-existing conditions because they change their job or lose their job. We could not have reached this day without you, Mr. President. At a time when this legislation was sinking into gridlock in Congress, your eloquent call for action in your State of the Union address last January made all the difference in launching the irresistible momentum that has brought us here today. Equally important as we entered the home stretch on this bill in recent months, your refusal to compromise on basic principles guaranteed that the final bill would be worth all this effort, and so that the bill you're about to sign did not become an empty promise or, even worse, a backward step. I know one other person who would have cared deeply about this bill. My brother fought hard for Medicare in Congress and as president, and I know that President Kennedy would be proud of President Clinton's leadership on health reform today and on many other issues too. This bill is important in its own right, but it has a larger significance too, as a sign of our commitment to carry this battle forward in the months and years ahead and build on what we have accomplished here. We will never give up the fight to achieve accessible and affordable health care for all Americans. When I say all, I mean all. We also could not have reached this day without the leadership of another very special person. Every valuable part of this legislation, from insurance reform to help with long-term care to assistance for the self-employed, was originally conceived and contained in the broad-based health reform proposal that you submitted to Congress in 1993, Mr. President. And so I give special credit to the person who did so much to shape these proposals and bring them to the attention of Congress and the nation, our outstanding First Lady, Hillary Rodham Clinton. Finally, we could not have reached this day without the leadership of a third very special person, one of the ablest and most caring senators of our time, or of any time. The American people owe special thanks to Senator Nancy Landon Kasbaum for this legislation. I only wish we had the support of more of her Republican colleagues in Congress when it counted. If we had, we'd have been here a lot sooner on this bill, Mr. President. Senator Kasbaum's leadership kept the bipartisan faith with health reform. She kept this bill on track. We could not have done it without her, and we're going to miss her very much when she leaves the Senate this fall. I'm honored to introduce her now, the senator I call Madam Chairman, a senator for all seasons, the kinder and gentler senator from Kansas, Senator Nancy Landon Kasbaum.
Thank you very much, Mr. President, Mrs. Clinton. It's a great honor to be here today. It was a year ago last August that this legislation unanimously passed the Senate Labor Human Resources Committee. But it has been a bipartisan effort all along the way. Many of my colleagues in both the House and Senate who have worked hard on this are here today. And certainly, as you pointed out, Senator Kennedy, Mr. President, you kick-started this when you mentioned it in January in the State of the Union speech. But we have worked on both sides of the aisle to make this day a reality. There were moments when we weren't sure we would get here, but I think both Senator Kennedy and I never gave up hope. I've said in a way, Senator Kennedy, who is the ranking member, of course, of the Labor Human Resources Committee, reminded me a bit of the wrestler of the team who was willing to take any opponents to the mat. And I sort of designated myself as the coach. But whatever happened, it worked. And I would also like to, it's hard to single out anyone, but I know I valued greatly the help of Congressman Dennis Hastert from Illinois, who chaired the House Republican Health Task Force. And let me say also, since this has been a bipartisan effort, it was Bob Dole, when he was in the Senate, who wanted to add the ability to have long-term health insurance be tax deductible, and also to increase from 30% to 80% the self-deductibility for self-employed. So it has been, this bears the imprint of both sides of the aisle, and I'm enormously proud because it will help many. And in the next Congress, I'm sure there will be further reviews of what should be done and how we can improve the system. But one of the things that is of special, I think, importance in this bill, that gives great comfort, is that you know there cannot be an exclusion for someone who has a prior health condition. It lends such a sense of security. And I would like to introduce someone now who is very special in that regard, Merritt Kimble. Merritt Kimble has been a dedicated advocate for health care reform for many years. She has worked with the Alliance for Healthcare Reform to secure meaningful health coverage for all Americans. Soon before her 40th birthday, Merritt was diagnosed with breast cancer. Not only has she battled this dreadful disease, but like millions of Americans with a pre-existing health condition, she has been faced with the prospect of losing her health insurance coverage. The legislation we are signing today will provide her and all Americans with a greater sense of security that they will be able to maintain their health insurance when they need it most. It's an honor and a privilege to introduce to you now Merritt Kimble. I don't think you need that, Merritt. Do you need it?
Yes, I think so. Thank you, Senator Kassebaum, for those kind words. And thank you and Senator Kennedy for holding the feet of your colleagues in Congress to the fire and getting this health insurance reform bill to the President. As Senator Kassebaum said, I work for the Alliance for Health Reform, and so I know something about the subject. I know health insurance isn't fair. I know that a lot of people with pre-existing conditions and people who change jobs don't have much hope of getting or holding on to the health insurance. But until recently, I didn't think I would be one of those people. As Senator Kassebaum said, last year before my 40th birthday, I was diagnosed with breast cancer. Soon after that, I lost a kidney to another cancer. And very recently, just after my 41st birthday, I learned that the cancer had moved to my bones. But I'm lucky. I have my mother and father, family and friends, who care and are helping me through this. I have good doctors, and I have a job with insurance. But my nonprofit organization isn't guaranteed to be here next year or the year after that. And I do intend to be here next year and the year after that. But without a guarantee of employment, I could easily become a woman with a pre-existing condition, looking for a job, and knowing that it won't offer me insurance. Believe me, that is bleak. For me, the Kassebaum-Kennedy bill has become personal, very personal. Without it, I worried that I could easily become a burden to my mother and father, that health care could be out of reach. That's scary, Sometimes it's scarier than having cancer. I cannot tell you, I am so relieved to see this bill become law, finally, because now I can use all my strength to get better. I have a pre-existing condition. I love my job, but I have to change jobs. I may have to change jobs one day. The difference is now I will have health insurance. I will have a fighting chance. For that, I want to say a special thank you to the President and the First Lady. They are doing something our nation has needed for a very long time. You both have shown courage, the guts to force America to look at the problems in our healthcare system. That's something a lot of people didn't want to do, but now we are, and this bill is the first step to solving our problems. So on behalf of millions of Americans, thank you and keep fighting. And now, it is my honor to introduce a champion for making health care better for all Americans, the President of the United States, Bill Clinton.
Thank you. Great. Thank you.
Thank you.
Thank you very much. Thank you. Thank you so much. Thank you. Thank you very much for that wonderful introduction, Merritt, and thank you for the courage of your example. I want to begin by recognizing the members of Congress who are here, who worked on this so hard. In addition to Senators Kassebaum and Kennedy, we have Senator John Breaux, Senator Bill Cohen, Senator Byron Dorgan, Senator Carl Levin, Congressman Mike Bilirakis, Congressman John Conyers, Congressman Harris Faywell, and Congressman Dennis Hastert, Congressman David Hobson, and Congressman Bill Thomas. I thank all of them for their work on this. I thank Secretary Shalala for her hard work, the SBA Administrator Phil Lader, who is here. I'd also like to recognize a gentleman in the audience who did a lot of work with the First Lady on this and who is, I'm sure, happy to be here today, our former Surgeon General, Dr. Everett Koop. Thank you, sir, for being here. And Dr. Henry Foster, it's nice to see you. Thank you for being here, sir. And there are so many others I would like to thank. I want to thank all those, the consumer groups, the business groups, the labor groups, the grassroots people, the people who were personally affected by health care problems and problems in our system, who were here. All of you worked so hard to make this day a reality. I want to thank all the people who worked on the staff at the White House, the people especially who worked with the First Lady from 1993 on. All of you should take some great satisfaction in seeing this day come to pass. And I want you to know that I will never forget the work that all of you have done and the service you have rendered to the American people, and we thank you. But a lot of people who worked on health reform were just folks. People that Hillary met traveling around the country, or people that I had the good fortune to run into who told me their stories and who helped to work to make this day a reality. People like Dan Lumley, who is here with us today, a man we met on our bus tour from Portland, Oregon. There have been many others who have helped, like Kristen Hopper and Tencia Alvarez, who are here with their families today. We thank you for coming here with your families. And let me again especially thank Merritt Kimble and her wonderful parents, Jack and Rosemary, who've come here today. They have had the courage to tell their story and to fight for their cause and on behalf of tens of millions of other Americans. They have given us the hope that together we can make things better for more Americans. The Health Insurance Portability and Accountability Act shows what happens, as Senator Kassebaum said and Senator Kennedy said, when we work together, when we cross party lines and put the interests of the American people first. This bill is a clear boost to our values as Americans. It offers opportunity by allowing people to take their health insurance from job to job. It rewards responsibility by helping people to work who desperately want to work. It brings us together in a common community to do what's right by all of our people, saying that we ought to make it possible for more and more people to succeed at work without losing the security of knowing that when they need health care, it'll be there. Health care reform is measured by how many lives it improves. With this bill, we take a long step toward the kind of health care reform our nation needs. It seals the cracks that swallow as many as 25 million Americans who can't get insurance or who fear they'll lose it. Now they're going to be protected. Never has such a measure been more needed for our people. Our new economy presents Americans with opportunities like never before to work their way into better paying jobs. And yet our health care system has worked to paralyze many workers who fear losing their health care coverage if they take those better jobs and change their employers. At the same time, millions of Americans find themselves labeled as people with pre-existing conditions, from cancer to AIDS, which disqualifies them and their families for coverage, including the husband, the pregnant wife who lose their insurance, the young woman who can't change jobs because her new insurance doesn't cover diabetes, the small business owner who faithfully pays group health insurance premiums for years, then finds that his coverage won't be renewed because one of his employees has developed a heart condition. No more. This bill changes all that. Today we declare a victory for millions of Americans and their families. No longer will you live in fear of losing your health insurance because of the state of your health. No longer need you hesitate about taking a better job because you're afraid to lose your coverage. And no longer will small businesses be denied access to insurance for their employees. The health insurance reform bill I signed today will protect the health care of millions of working Americans and give them and their families something that cannot be measured: peace of mind. The bill also addresses other problems in getting more affordable insurance to our workers. It makes it easier and less expensive for the self-employed to purchase their insurance. As Senator Kassebaum said, it phases in a tax deduction of 80% for the self-employed and helps to even the playing field with bigger businesses. Second, it prevents fraud and abuse. It toughens penalties and helps us to go after bad apple health care providers who bilk the system of millions of billions of dollars from Medicare, from Medicaid, and from private insurance companies. I especially want to thank Secretary Shalala for her work on these fraud and abuse provisions. Third, it makes the health care system more simple. It will modernize, streamline, and cut the cost of insurance paperwork by devising a uniform electronic system for paying health care claims. It will provide steps to protect the privacy of people in the system as it does so. Fourth, it allows the establishment of a limited number of medical savings accounts to allow us to study this approach and see how it works, to determine whether this new approach can make a positive contribution to health care coverage and to affordability. And fifth, it helps with long-term care. It provides consumer protections and makes long-term care insurance more affordable. This bill, in short, does a very great deal. I want to echo what Senator Kennedy said. Senator Kassebaum, we're deeply in your debt. We're going to miss you, and you must be very proud that here in the last months of your career in the Senate, you have done such a magnificent thing. We thank you so much, ma'am. Senator Kennedy, as I told you before we came out here, when I woke up this morning and thought about signing this bill today, I remembered a day a very long time ago, almost 18 years ago now, when I moderated a panel on health care reform in Memphis, Tennessee, at one of our many conventions in 1978. And you were there telling the American people in 1978 that every person in America deserves the health care that your son had when he was first taken ill. I'm proud of you for these 2 decades of commitment, sir. Thank you. And if you'll forgive me a personal note, I believe, Hillary, that this justifies all those days on the road and all those nights you stayed up reading the incomprehensibly complex issues of health care. Thank you. Thank you. I wish this bill had contained the provision to eliminate the differential treatment of mental health coverage, or at least taken some positive steps in that direction. I know this is something that's especially important to Tipper Gore, and I know that we all know that we're going to have to deal with that. And we have to do more, and this is also very important. We must find a way to provide coverage for workers and their families who are in transition. I have proposed a plan which we put in our balanced budget to cover 3 million workers and their families, including 700,000 children who today have nowhere to turn for affordable health care because the worker is changing jobs. If a person is doing the right thing, trying to be responsible, dying to go to work, we should help those kind of people to get back on their feet without being thrown flat of their back without health insurance. Our mission in pursuing health care reform from the start has been to provide more fairness and quality for the American people. That's why we work to strengthen the Medicare Trust Fund, although we must do more, and our balanced budget plan does that. That's why we've worked to preserve and to protect Medicaid, why we focused on the problems of health care costs, which thanks to efforts in the private sector, to our own efforts, and to the general direction of our economy with growth with low inflation. Inflation in health care slowed to 3.9% in 1995, the lowest in 23 years. And for the first half of this year, it is down to less than 2% and may go lower still. We must not let this be a temporary development. That's also why we've worked to raise childhood immunization rates dramatically, to increase investment in biomedical research, including funding for breast cancer and AIDS, why we've expedited the FDA review process and approval for new drugs so that people who need a miracle might be able to find it, why we fought to protect our children from the harmful effects of tobacco advertising aimed at them. But now we need to build on what we have achieved. I was encouraged to see Senator Kassebaum with her coach's mentality, saying that the game is not over and we still have another month this year. And Senator, I'm suited up and ready to play, and I appreciate you saying that. This is a particularly happy day for me because, like yesterday, when we signed the minimum wage bill and the bill which gave such strong incentives to small businesses to invest in their own businesses and made it so much easier for people to adopt children who are willing to take on that profoundly important responsibility, these 2 days together, and this day especially, helps ordinary Americans to benefit from the growth and progress in the American economy. America is on the right track, not only when the overall numbers look good, but from when every responsible American family can participate in that. It's good that we have 10 million new jobs, record numbers of new businesses, that we have the lowest deficit and the highest rates of home ownership in 15 years. That's very good. But it's even better when every single American who's willing to be responsible for his or her family and his or her work can participate in those trends. And with portable health care, the minimum wage increase, additional incentives for small business growth, more pension security, moving people from welfare to work, that will help all Americans to be a part of our 21st century America. We have more to do in educational opportunity and helping people with their child care and child rearing obligations and helping people to buy their first home. in finishing the job of balancing the budget so that we can keep interest rates down and inflation down, but we are clearly moving on the right track. I look forward to working with Congress when they come back in September and to continuing this effort. I want to say again, this bill passed almost unanimously. This is a bill that both Senators Kennedy and Kassebaum can be proud of because they brought all their colleagues along with them. This is a bill that people who've been working in the House for years and years and years on health care reform can be proud of, and so can everybody else who showed up and voted for it. And Congressman Hastert, I want to echo what Senator Kassebaum said. We appreciate your work, and we know how much you did to get those last few difficult issues resolved in a way that we could all live with. We can do things when we work together and put the American people first. And whenever we work on behalf of our families and our children, as we do with the Health Insurance Portability and Accountability Act, America always wins. So now, in the names of the families and children who will have better lives because of it, I am honored to sign this profoundly important piece of legislation. And I'd like to ask the members of Congress to come up and join me along with the families who are here. Thank you very much, and God bless you.